And when you're asking somebody to take an injection and you have people out there articulating things about it that are not true, but may be just creating enough doubt, you have folks that say, I'm going to wait and see. And the shame of that is we have had the benefit, if you want to call it that, of seeing what COVID does to a woman that's pregnant. And that's why the American College of Obstetrics and Gynecology and the Society for Fetal and Maternal Medicine have both strongly come out and said, please get vaccinated if you're pregnant or even if you're thinking about getting pregnant. Because we now have the experience of seeing what it does to people who are pregnant, and they get women who are vaccinated or who are unvaccinated who are pregnant and get COVID. It is a horrible, horrible illness. And we've seen women in the ICU have to have a procedure to remove the child that's very premature, as early as 37 weeks.
So sometimes as early as 28 weeks.
28. That's right. We had a 28-week
Yeah.
premature. We had to do a procedure in the ICU to remove the child and bring the child to the NICU to try to save the woman's life. And you don't have to see too many of those before you become a believer that they really should. That's why we wanted them to talk to their OBGYNs. And so, of course, we've also leaned heavily into the religious and medical exemptions. People may have strictly held beliefs that we want to respect. And so certainly we consulted with our ethics committee, which involves members of the clergy, people in the community, nurses, doctors, to make sure that we approach this consistently and fairly and appropriately respect people's religious convictions. So we've tried very hard to respect that there are multiple viewpoints. Some of them are very strictly held, and morally, ethically, and frankly legally, we hold ourselves to the highest standard possible to make sure we respect those differences.